So, for the last 2 months in a row, unfortunately, the Myla has been the worst performing hospital in Wales when you look at the targets in terms of seeing patients within 4 hours.
That's not good, is it?
It's not good. And looking at the stats for the Myla, less than 40% of people were seen within that 4-hour target. The actual target is 95%. Not that I think we've ever met 95%.
No, I don't think any hospital in Wales has of late.
No, but as bad as it is in the Myla, when you look at the trajectory over the last 10 years, you can see that decline happening. So if you go back to 2014, at that point, 72%, I think, of A&Es were seeing patients within 4 hours. That was the Welsh average. When you look at 2024, December 2024, that had reduced down to 54%. So it's under 40% in the Myla, so there's obviously a specific issue there, but you see that trajectory. So there's clearly huge pressure on the service. So what we're going to look at and explore today is, why is that? What are the fundamental issues that are causing that? Yeah. And then what do we do about it?
Yeah, I think the simple thing, it's very simplistic to look at A&E waiting times on their own. There's a whole range of issues behind it, isn't there? The first thing you could say is GPs and access to GPs has become very problematic in some surgeries.
Definitely in some, in mine.
We've got very different examples.
Yeah.
You know, you're having difficulty accessing your GP. I'm not, a big sort of shout out to the Garden Road surgery, if we're allowed to name individual surgeries.
But it's a postcode lottery, isn't it?
And let's be honest, even that surgery used to have surgeries taking place in Hightown and in Rhos Dyllen, and no longer does it do that. It's sort of back in Rhos now. But that will allow you to see a GP in a timely fashion, and that's really important. I think you need to see a GP when you're ill. You can't predict when you're going to be ill, and that's when the problems start. If you can't see a GP and you don't get much sense out of the online services available,
or the phone line, you're going to end up in A&E, aren't you?
And very often the phone line will say, well, you better take yourself down to A&E just in case, you know. So that's when that service, the GP service, starts to impact on A&E. And we've been saying for a long time, we've been talking to GP for a long time, there's a general problem with GPs wanting to retire earlier, feeling under pressure, wanting more part-time work. And you know, we've seen a lot of GPs just leaving the service completely.
But that's not new news, is it?
No. Well, the thing is, I know the BMA did a survey, I think it was 5 or 6 years ago, and Wrexham in particular had a problem with, I think it was the highest in Wales, saying GPs were going to retire within 3 years. And that means you need to be thinking about how you replace these GPs or make it attractive for them to stay on for a couple of years longer. And I don't think Welsh Government has been sufficiently proactive in working through those problems with GPs, for example. GPs do 90% of the face-to-face engagement with patients, but they only get something like 7 or 8% of the NHS budget. Well, that's, clearly there's an imbalance there. And I think GPs have made the case, and I think we'd support them, that you need better resource right at the front line of the NHS to make sure that people are being seen, they're being treated, they're being dealt with. When they need to be referred to a consultant or more health professionals, whether it's an X-ray or whether it's more investigations, fine. But they have to see those people first. Otherwise, they are going to default to A&E.
So that's an interesting point, though, because what you've said about more funding at the front end of the service for GPs is a similar point that Marc Drakeford made the other week on the Will Hayward podcast, wasn't it? But then went from there to say, we need fewer hospitals.
Yeah, that was really... I'm going to be sort of cutting some slack, because the last thing you want really is for somebody to have to go into hospital. They're very expensive and not a great place to be for a long time. District or hospital.
Yeah.
Nobody really wants to be there. They'd rather be at home. But it's all about the prevention agenda. And, to get to that stage, we say, actually, we need fewer beds. We need fewer hospitals. You've got to have sorted out all the preventative stuff first. You've got to have tackled some of the big crises. And you've got to have tackled the waiting lists. And at the moment, we have got huge waiting lists. People waiting 2 years for treatment and getting worse.
Yeah.
So it was at best a very naive thing to say. At worst, it was crackers.
And would that model that he's talking about even work in Wales? It might work in a big English city, say, but Wales isn't a big city. It's very different, isn't it?
I know there are previous health ministers who have referred to Birmingham, 3 million people in Greater Birmingham, 3 million people in Wales, as if they were the same thing.
Yeah.
And you kind of go, if you know anything about geography, if you know anything about demographics, that's why we've got 3 district general hospitals in North Wales serving 70,000 people, because you need to have access to that expert care and expert treatment, not 3 hours away, as it would be otherwise. You need it to be the timely way, and it just beggars belief that somebody thinks that you can just transpose the Birmingham model
Onto Wales.
Yeah. And we have a totally different population. We have an older population as well. I think we should be very honest about this. We've got an older population. We've got a sicker population. We've got worse housing. Housing is known to cause worse health outcomes. So all these things, coupled with heavy industry and the legacy of heavy industry on people's health, all those things add up to a really big challenge, especially here in the north, because of the rural element. But it doesn't mean we can't fix things. And I think it's really important that we don't despair and we don't fall into this sort of mentality where we go, oh, well, nothing can be done. Let's I've seen people saying, oh, the NHS is broken. It's not broken. Most of the time, it works really well for most people. There are lots of examples where it doesn't work so well. But I think, we need to...
And if you privatise it, it wouldn't work at all. We've seen that over and over again, haven't we?
Exactly, and there are people who, there are political parties that are pushing for privatisation.
Yeah, reform. Yeah.
And I think, to be honest with you, the whole Tory agenda over the past 14 years, which has been to defund and run down public services, including the NHS, that's led people to be going, do you know what? I can't wait 2 years for it, replacement. I will pay for it.
And you can understand why people would think like that. But then, if you look at the bigger picture, this is what happened, isn't it? With rail, with water, with energy, all of these things. They run a service down so that they can say it's not functional. They privatise it. But then what you get at the end of it is a worse service.
You get service and you get it bailed out by governments as well. Because the thing to remember with private healthcare is when things go wrong, they don't sort it out. They send it to A&E.
Oh, there's no private A&Es, is there?
No private A&Es. There's no private blood banks. All these things, they are relying on the NHS to bail them out when things go wrong and to train the staff. We should also remember that.
Yeah.
There's no, Spire, Bupa, all these people, they're not training staff. They're taking NHS staff who've been trained by the NHS.
Staffing is the one issue that comes up. Whichever part of the service that you look at, and you look at the pinch points, whether it's accident emergency, whether it's GPs, just generally staffing, we know, is a huge problem. Because we know, I remember going back 10 years with Leanne Wood calling for the recruitment of 1,000 doctors. We knew then the NHS was understaffed. There was that stat a couple of years ago, I think, where it said Wales per head of population had less doctors than anywhere else in the EU other than Poland and Romania.
Yeah.
It's clearly an issue in terms of doctors. It's an issue in terms of nurses, because is it 2,000 nursing vacancies currently?
2,000 short across Wales.
Yeah.
It was 500 short in Betsy. And there are 3 ways you can look at that, to bridge that gap. One is to retain staff. And that means talking to staff and making sure that you offer them the best possible package to stay on, because people are getting burnt out because they're overstretched, because those vacancies mean that the people are left are having to do more.
Yeah.
And I think COVID saw, a lot of health care professionals died. They got very ill. They had long-term issues post-COVID and were burnt out. And I know of people who've left, skilled nurses who've left, critical jobs to go into other jobs.
And that backlog is still there, isn't it, from COVID even now?
So we haven't met that need, and we haven't really addressed this thing. If you've got a vacancy problem, you've got to think, how are we going to fill it? And that, again, takes time, takes 3 years to put a nurse to a degree course, like they've got in Glyndŵr, and it's really good to see that we have got training here in Wrexham for nurses, paramedics, other allied healthcare professionals.
But Wales-wide, we had that news last week, didn't we, in terms of Cardiff Uni, one of the biggest nursing schools in Wales, looking to close their nursing course. So, you have to ask, don't you, when you look at the issues with training, you look at the fact that we've got these gaps in terms of staffing, where is that long-term vision and planning for workforce recruitment and training? It just doesn't seem to have been there. We've been raising these things for 10 years, but, Welsh Government don't seem to be listening, do they?
Well, I remember 10 years ago, Carrie Jones, who was then First Minister, saying, we have no GP crisis. What are you talking about?
But the data was there.
But the data was there. We were warning about it, and had we actioned that 1,000 doctors pledge back then, we would now have doctors rolling off the production line, if you want, and coming into the service. Because I did start to say about the 3 ways to get staff in. One is to retain, one is to recruit, from other places, and the other one is to train more. And I don't think recruitment has particularly worked. We've brought in nurses from overseas, and to be honest with you, that hasn't worked. It's a short-term, stopgap.
And there's a whole issue with agency as well, isn't it?
Yeah, and because nurses are feeling, in particular, but also doctors, are feeling burnt out and they want a work-life balance and they want more flexibility, perhaps because they've got childcare or other caring issues. They want to be able to pick and choose when they work rather than be on a rota and have to do certain shifts. Now, if you can get more money working for an agency to do the same work,
what are you going to do?
You're going to do it. So I think health boards have to really look at how they care for their own staff far more. And that's the same thing with GPs and doctors who, want that work-life balance. It's quite understandable. So we've got to really be thinking about that, and the savings you can make from not paying those exorbitant agency costs can go into paying staff, permanent staff.
Something else that's been said for years. So why aren't they doing it? That's the frustration, isn't it?
Yeah, we seem to lurch from crisis to crisis, and like you say, the performance is going down and down and down, and there's almost a paralysis in Welsh Government, and they can't say, oh, nothing to do with me, because in Betsy, in North Wales, they've had direct control of the health board for 6 of the last 7 years. They've made a big play of, oh, we're intervening here. And then they came out and said, well, that's it, we're out to special measures now. It was conveniently just before the last election. And then after the election, they went, actually, we do need to go back into special measures. But nothing changes.
Is there any other health board that's been in special measures for such a period of time? I don't think there is there?
Not in Wales, and I'm pretty certain not anywhere else in the UK. And that begs the question, if you know you've got a problem, why are you just repeating the same solutions?
They're not working, they're clearly not working. So we know there's a massive issue with access to GPs. There's a massive issue in terms of staff. We're short-staffed. There doesn't seem to be that plan there in terms of workforce recruitment. But then the other thing is that streamlined connection between health and social care isn't there, is it, either?
Yeah. A lot of the problems we're seeing at the moment is again, to talk about A&E, is not being able to move people out of A&E and onto wards, because the wards are full. And very often the wards are full of people who are ready to go out.
Yeah, they could be at home.
Ready to go back out to the community, whether it's to their own homes with a package of support or to a step-down facility, which be a community hospital of some sort. And you've got to ask yourself then, where is the joined-up thinking in all this? Because, getting people out of a general ward, which is not good for people long term, you become institutionalized, don't you?
Yeah.
But also, it's somewhere where, unfortunately, infections are rife. People can catch infections in hospital, but they're also very expensive compared to a community facility like a hospital or back in your own home. So the economics doesn't add up.
No.
Quite apart from the fact that when you're in your own bed, generally you're going to feel better if you've got that support around you.
So there's a real case for merging health and social care. And this, again, is one of the frustrations. It's something we've been talking about. Again, probably I think 10 years ago, we did a consultation on different models that you could look at to merge health and social care. But the only way you're going to tackle this is if we do move to a model where you have a National Health and Care Service, so NHCS, effectively, a new model that can start to address some of these fundamental blockages in the system. When you streamline that and you have both services that are free at the point of need, then we can start making some progress. I don't think anybody's saying that's going to be easy to do. There are different ways you could come at it. But again, it just seems to be, these calls are made and they just seem to go into the ether. Nothing ever happens.
It's funny, isn't it? Because everyone talks about the need to do it,
but they don't do it.
It doesn't happen, yeah. So it's pointless. Anyone can see that, if my auntie has gone into hospital, got sorted, ready to come out, then she needs to be prioritised to get them out so that somebody else who actually needs that hospital bed can get it. And it should be that kind of seamless transition, shouldn't it? But we don't seem to be thinking about the care side of things.
No.
We don't value care in the same way as we value nurses, for example. Care staff are very much the Cinderella service of this whole discussion, really. And, if you're on low wages, you're getting treated badly. We saw in COVID how care homes are treated abysmally.
Yeah.
And you really do need to value staff, value the service they're given, in the same way as I think we value nurses and healthcare professionals. We need to bring them up to the same level. We need to treat them in the same way. And that then means you've got a better service there.
I think as depressing as it is looking at the situation in terms of where we are, because there are clearly huge challenges within the NHS, and one of the things is it needs proper investment. There's no getting away from that. That is one of the problems. But you can see just after a short conversation, some of the other issues there are about management, aren't they? And they are things that are solvable. And looking at new ways of working, looking at merging health and social care, having that long-term plan with staffing, it can be done. There is hope within the conversation, as we said at the start, isn't it? It's not all doom and gloom. It hasn't got to be managed decline, but it just seems that, Welsh Government have just buried their head in the sand when it comes to health generally. Unless there's a change of gear, unless there's a fresh start and people who are willing to look at this and actually, do the work to get these new solutions off the ground. And it's not easy. Nobody's pretending it's easy, but you need the willpower to actually do it, don't you?
It does seem to be this almost paralysis because the NHS is a big organisation. I think it employs 100,000 people in Wales. So it's a big employer and it has a huge impact on all our lives. We all rely on it in one way or another. And when you talk to people in the health service, I think the gap between the ward and the board, the ward and the senior managers is way too big. There's not enough engagement from senior managers. I'm not going to tar everyone on the same brush. I think there's some really good people in there, that it seems that there's this organisational paralysis, which won't learn from good examples. There are really good examples throughout Wales and beyond where we could say, do you know what? That's cut waiting times. And I know there was the example recently in Swansea. They worked evenings, they worked weekends, and they cut waiting times significantly in one sector. Well, that seems like a sensible...
So look what they did. Yeah.
It's not rocket science.
Yeah.
You know, obviously there's a cost there if you're expecting people to work different times and days. But the priority surely has to be to get people better again. You know, if they are ill. Like I say, I'm of the opinion that we do need more preventative work. We need to be, people need MOTs as far as I'm concerned. I know as a diabetic, I get a really good service from Betsy. So I'm going to be as positive as possible because they recognize that, if you're a diabetic, you've got certain issues, maybe with your eyesight or feet, and they give you an annual checkup. Now, lots of people, I think, go through their health life, if you like, not getting those checkups.
Yeah.
And perhaps we do need to be thinking about that far more. But I don't see that kind of joined up thinking generally.
No, and I think as well, there's been a tendency from Labour to look to centralise services, and we've seen that locally and the impact that's had in terms of community hospitals as well. Fflint Wrecsam, you're losing those beds within the community and that service within the community that can maybe pick up some of the preventative stuff, but also some of the rehabilitation stuff as well. We've lost that, haven't we? And there's a real case we've been looking at what we can do locally and what some of the solutions might be. There's clearly, specific problems at the Myla. So a community hospital is the way to go.
Yeah. It's something, obviously it's not something you do overnight, but I think Wrexham is somewhere which needs a community hospital. We have some very good ones not so far away. Chirk is seen as a good community hospital. Mold is seen as a good community hospital. It provides that lower level care. It's called step up and step down between being at home and being in a district general hospital like the Mailer. It would take pressure off the district general hospital. It would enable people to get that care that they need. And I think we have really got to examine how we deliver that kind of care. We've got a population that is getting older, Unfortunately, that means having issues, with health issues. So we've got to be planning for the future. And that's one way to plan for the future. And I think we should be looking at, and there are empty buildings in Wrexham.
There's one I can think of in the town centre, actually, that would make a fantastic community hospital, I think.
So it's a building that could be adapted for a new purpose, which would suit a lot of people, I think. We need to do some more work on how we finance that, how you would equip it, how you
staff it.
Staffing is critical, because if we don't have the staff, then you can't do it. That means, that the training has to be increased. We've got to, you can't let Cardiff University just unilaterally say, oh, we're cutting 1,000 nursing training posts.
Yeah, and the Welsh Government seems surprised
that to save some money. Why is that even possible in a joined up service? We should be saying, and we would make the case for increasing provision in Glyndŵr years ago, and thankfully they have increased that. But there was a stage that Glyndŵr couldn't send their trainees on placement to the Mailer. They had to go either into private or into English health trusts.
Ridiculous.
No joint thinking. That has changed, but only after a lot of pressure. So we need to up the capacity to train specifically in the north, because when you train somewhere, you're more likely to stay in it. And that is basic, absolute basic. And that applies to an awful lot of things like dental schools and medical schools, but also nurse training. So that's a way forward, but it's going to take time, and we need some urgent action as well, don't we?
Yeah, I think there is all this doom and gloom when you have conversation about the NHS, but it is fixable. There are things that can be done. So people who are watching this can see just after a short conversation, you can soon pick out a roadmap that works going forward, that will improve services if the political will is there to do it. And I'm sure with health, there's just so much more to say. We definitely want to come back and do something on dentistry, ambulance wait times, which links into A&E, and there's lots, isn't it, that we're going to talk about.
I mentioned ambulance wait times.
No, and anybody going to the Milo will see that queue of ambulances outside, but some of the fundamental issues are the same, aren't they?
And again, that's not a new thing. Years ago, talking to an ambulance driver, saying he would clock on for his shift, pick up the first patient, half an hour later, outside the mailer, and he was there for the rest of his shift. Well, that's not productive for anyone, is it? And that's where the waste is in the NHS, is where people are having to hang around and not do their proper job because there's not capacity further down the line. We've got this massive logjam. Until we start recognising the logjam and unjamming it, then we're going to have queues of ambulances outside the mailer.
Yeah. I think it'd be really good as well to get some feedback in terms of what people think about the idea of a community hospital in the town centre.
Yeah, absolutely.
It's something we've started to talk about and started to research and be really interested to know what people think.
Tell us what you think.